Hello, my name is Dr. Mike Thomas and I'm the Asthma UK Senior Research Fellow at the University of Aberdeen, and I'd like to introduce you to some data that we've recently published in the journal Pragmatic and Observational Research on a survey performed by specialist physicians in the UK on their preferences for a combination of inhaled steroid and long-acting beta-agonist inhaled therapy for treating asthma. So why did we do this study? Well, we know that at this moment in time inhaled steroids are the cornerstone of asthma management and they're widely used in COPD. Long-acting beta-agonists also have a major role in both conditions to try and achieve control of the disease. There are numerous combinations of inhaled steroids and long-acting beta-agonists currently available, and in this piece of work we attempted to survey specialists in the UK to try and understand their perceptions of what the most effective combinations are. In November 2009 we performed a survey using the survey company Connect Healthcare Insights via the doctors.net.uk website. And we targeted UK respiratory physicians treating asthma and COPD and seeing at least 20 patients per month. So in this study, physicians were asked which single and dual inhaler inhaled steroid and long-acting beta-agonist combinations they considered the most effective for treating their patients in asthma. Patients could choose from a pre-provided pick list, but were also asked for unprompted free text answers. And we asked them what their ideal inhaled steroid was, what their ideal long-acting beta-agonist was, and what their ideal combination was. In all, 98 physicians completed this survey, but only 82 gave permission for us to use their data, and these are the results we present. We can see that physicians considered fluticasone to be the most useful inhaled steroid and the long-acting beta-agonist formoterol to be the most effective member of this class. So this graphic shows us the summary of the results, and we can see that the combination of the two was the most effective. When the components were analysed individually, fluticasone was felt to be the best inhaled corticosteroid by 44%, and formoterol was felt to be the best long-acting beta-agonist by over 80%. We asked about the reasons for choosing these molecules. Factors that were felt to be important by clinicians were speed of onset, overall strength of effect, and potency. So formoterol was felt to be the most useful long-acting beta-agonist because of its rapid onset of action, and fluticasone was felt to be the most useful inhaled corticosteroid because of its potency. There are, of course, some limitations to our study. This was a UK-specific study, so we can't necessarily extrapolate our results beyond UK specialist practice, and we can't assume that the similar preferences would be identified by generalists and general practitioners. However, our results do reflect market trends which show that fluticasone is the most commonly prescribed inhaled steroid in Europe. Formoterol is also a very widely used and popular long-acting beta-agonist. Further research would be useful in this field to evaluate what specialist physicians and indeed generalist physicians' perceptions of the most effective combinations of inhaled steroid and long-acting beta-agonist are. This is a therapy that's going to be with us for the foreseeable future, and it's very important that we get the most effective combination for our patient. Thank you for listening.